Hi guys. Have you ever wondered what your career prospects are after completing Bpharm and felt confused? So in today's episode, I'll be joined by an amazing guest, Mridula Ramkumar from Bangalore, and she'll be sharing her academic journey as well as professional journey with us. She completed her Bpharm from Amrita School of Pharmacy, Kochi. She topped her batch and then decided to do her MS in NIPER, which is the National Institute of Pharmaceutical Education and Research, Mohali. And then she shares how she started her career and also where she is today. Like after completing your B pharmacy, so that's like the 4-year course, were you like so sure that you want to do start working or do another master's or do the M Pharm? So what was your mindset then?
Okay, so at that point, so one thing was that I was very naive at that point of time, right? So as a pharmacy graduate, you're not very aware of what are the career paths that you actually have. So for me, one thing was sure was that I did want to pursue a master's degree or a postgraduate degree because it did give me the flexibility to either later go for a job or pursue a PhD.
Yeah.
So that was my thought process. But apart from that, I didn't know what were the career paths that were possible at that point of time. I was pretty naive and I just focused on clearing exams and going into the best college possible. So yeah, that was my outlook at that point of time.
Yeah. So
Yeah.
for this best college, I understand that at that point in time, everybody was talking
Yeah.
about it.
Yeah.
And clearing, getting into NIPER, you have to clear this exam called Gpat. Am I right in understanding that?
Yes.
Yeah.
Yeah.
So how was your preparation? When did you start, or was it too last minute, or did you start very early?
I would say I started maybe a year earlier when I was in my third year, sixth semester to be correct. Yeah, and I kept it very simple. Like again, I did not have the idea of the competition that exists in such kind of exams. So it's only once you actually reach the college that you understand that people prepare for it for a long time, and there's a coaching class available, and there are so many things available. So you do not know at that point of time. I was just enjoying my college life, and I did know that I had to prepare for this exam. But yeah, I had kept it very simple. I had gotten the official GPAT guide at that point. I think it was the Pearson's one. I just had that one book, but I used it very extensively. Like it had like topic wise and subject wise MCQs, and it had solved question papers at the end. So I made sure to do as much as possible of it. And I kept it very simple, as in like maybe I set a daily target that I should do like 20 or 30 questions per day. And I did not force myself to do like it should be of one subject or I should do this one day. I kept it very simple so that I do not overwhelm myself, that okay, yeah, this is happening. But I believe that, more than the number of hours, it was the consistency that helped me somehow, because I just made sure that okay, I do like 20, 30 questions per day, and I kept it consistent throughout a year. And towards the end I did prepare more, of course, but yeah, I think consistency somehow helps you. I'm sure everyone has like a different method of learning, but the best is to find an optimal method and just to stick to it. And I think 1 year is a good preparation time for GPAT. Also, another thing that I did is at that time, GPAT was conducted by AICT. So they had an official website, and in that, they had like practice question papers and practice tests. So I did that as well because just to get a feel of how the computerized test would be, right? You do not want to appear in the exam and not know how the exam is going to be. So I did that. And I was also very fortunate that at that year, our college had introduced like extra classes for GPAT for my batch. Yeah, I was very fortunate in that terms. And, there were always some tips and interesting techniques by the professors as well, right? So, yeah, I made sure not to miss any of those because you never know where you're going to get those ideas from. So, they would have analyzed the question papers and they would tell us some great tips. So, yeah, I think these three things is what helped me, to crack the GPAT.
That's amazing. That's amazing that you mentioned consistency is very key and very important. And also, I kind of have noticed from my co-batch mates who were doing Bpharm at that time, like even before you pass out Bpharm, you get the GPAT results. Is it like that?
Correct.
Okay, so you
Yeah.
kind of know, okay, after completing Bpharm, I can go to another college. So that's
Yeah,
really
you have
so
different
can
options.
you like give like an experience, like how was it moving from a private institution going into this NIPER, which is government based, and also how was your experience there? Was the teaching different? What can a person who is like right now planning to go to NIPER experience?
So I actually had a great time there. So I went to the NIPER Mohali branch,
Okay.
and it was like I had a very good time because again, since it was a national institute, the advantage was that there were a lot of students coming in from different states.
Yeah.
So it is a good time for you to interact with everyone and understand. And that's when I actually understood that how much people have prepared throughout, to get into these colleges. So it's always a good exposure to see, how people have worked hard and how people are focused into this pharmacy area and how it impacts the research. And one thing was like NIPER is very research focused. So it is something where you do your master's and PhD. They have extreme focus on research and they have all the facilities to enable you for that. So like more like some of my classmates even got PhD positions abroad. Yeah. So like the professors that there have connections with international institutions and they motivate you to go more into research area. Going there is always advantageous. So like you get to interact a lot, you get to build your skills, you get to experience a different lifestyle. Being a government institute, you get a lot of facilities that comes along with it. There's a lot of benefits. Like I used to get stipend both the years, and so it was a good time. I could travel a lot as well because Mohali is somewhat located close to a lot of tourist places like Rishikesh, Manali, and all that. So
Yeah.
overall, it was very enriching experience for me to have gone there and done my masters. Yeah.
Oh, that's really so cool to know about that. And also the stipend part, I wasn't aware about it.
Yeah.
And so if someone is planning to go to NIPER, this is something
Yeah.
that is
So
really
yeah.
inspiring and motivating to get into NIPER, right, Rhea?
Yeah.
Thank you so much for sharing that, Chichi. So,
Yeah.
so what was the course that you did? Was it MS or
Yeah.
yeah,
Yeah.
MS
So
in
I did MS in pharmacoinformatics. Again, I have to be very honest that I had no clue about this course before I went for my counseling. I was like this very clueless person standing in midst of the counseling process. Um, but yeah, the course has been very good. It is a department unique to NIPER. So basically, it was designed to help pharma students or students with a scientific background to integrate the science knowledge with the latest updates in technology. So
Amazing.
like in addition to like the core pharma subjects, we did learn about certain programming languages like C++, Python, SQL, and we also had courses in bioinformatics and biotechnology. So all that was very interesting. It there is a lot of opportunities in fields like computer aided drug designing and testing, and uses of artificial intelligence and machine learning in healthcare, or whether it is creating databases, because there's a huge amount of data in healthcare, right? So there should be a database to use these data effectively. So yeah, it's an extremely good option if you're like a very tech savvy individual and a scientific background. Yeah, I did not have any clue about it. So one of my suggestions to anyone who would be preparing for NIPER or any other particular institute would be, to actually go to the college websites and see what are the courses available, what is your interest, and then talk to seniors who are already there in,
Yeah.
those colleges and try to understand that, what does this course entail, what are the job opportunities after that. So I think all that would help make the decision easier and make your career easier.
Absolutely, absolutely, Shisha. I was not aware about it, honestly. I've seen
Yeah,
like many of the abroad universities kind of offer these kind of courses, like bioinformatics kind of courses. But
correct.
I am like kind of like awestruck to know that, okay, NIPER is offering such courses and
Yeah,
also integrating machine learning, something that
correct.
it is very important and it is much sought after. Like, you know, the subject
Yeah,
matter expert and you also have this tech savvy.
yeah, exactly.
So that's like really cool. Thank you for that information as well. And also, so how was your journey into the new like the pharma industry? So after completing the course, did you
Yeah.
know where you wanted to go, or were you like, okay, let me take some time?
So I always thought I'll end up doing a PhD. Like I was interested in research, but when placements came, I thought, okay, why not? Let's just try working for a couple of years, and maybe then later on, I PhD you can always do a bit later on as well, right? So I was in that mindset, and I'm like, okay, let me sit for placements and see how it goes. Uh, yeah, but again, like it is good that you're having such kind of initiatives where people get to know what are the different career options available. I just prepared for the placement. I went and sat the placement, got a job somehow, luckily. But yeah, the job area is certainly very different. And I got into a field which I didn't know anything about. But I'm still continuing in that field because I love that field. And it was very interesting to learn about it. But yeah, I wish I had known a little bit earlier that, there are so many options available for pharma graduates. You know, um, I think we tend to have a mindset that, pharmacy graduates in India have very few options. Like it's either hospitals or academics or research. But that's not the case. There is like countless opportunities right now. And I just I've had 6 years of experience right now, almost working in this field. And I can say for sure that there are so many opportunities. It's so right now I work in a market research field, but apart from that, there is sales, there is HEOR, there is clinical trials coordinator, there is product management, so many, like even jurisprudence, patent research. So there are countless opportunities. So it is, good for pharma students to know that, there are many opportunities out there. And based on your interest, you can actually select the area that you're interested in and try to focus your preparation to that accordingly.
Yes,
Yeah.
yes, absolutely agree with you, Gigi. I have like 2 points to share. Like the thing is that most of us who pass out of pharmacy, I think everybody gets this starting point at pharmacovigilance, and somehow
Yeah,
their career is like around
correct.
that. But they never have they ever experienced like various other opportunities and
Correct.
scope of pharma. And second thing is about the placement that you mentioned. So is it only at NIPER that you get these kind of placements? So how is it the campus placements or a campus interview that you're talking about?
Okay, so I went, NIPER had proper placement programs, but as far as I know, a lot of institutes are actually offering it right now. So I think more and more the pharmacy institutes are coming up and trying to talk to industries and trying to get their students hired. So I don't think it is very limited to NIPER alone. So I know there are a few other institutes that are doing the same thing. Yeah, so I went through a proper placement program through NIPER and I got placed before I completed my master's.
Oh,
Yeah.
that's amazing. So, like, did you have to go through an interview process? So, if for anyone who is watching this video, if they are like very fresh out of their pharmacy college, how was the interview process? Like, what is hiring process in India look like?
Process might vary from company to company, but typically there is an aptitude test, a group discussion, and one or two technical rounds, followed by maybe a final round with HR.
Okay.
So this is I'm talking about like a college placement scenario. This is when companies come to the college. So sometimes in case of consulting companies, they might also have like a additional case study round, where they ask you to solve a case study, and then your first round of interview would be based on how you have solved the case study. So yeah, those are the three rounds. Ideally prepare for such kind of, placement programs. First thing that I did was at least I talked to my seniors to understand, how the program works,
Yeah.
and then you start your preparation. So like first step, if you say aptitude test, it is something that you can prepare for from your end, right? You can use simple practice tests. These are available online also, and you can take either like a guide or a book that is available through Amazon or something, and you can buy and you can do it yourself. But one point that you should always remember is that aptitude test is always just like a clearance test. You just need to pass with a cutoff mark. You do not need to prepare so much that you come out at top of it. You should be very smart in where you put your efforts. So aptitude test is something you just need to pass. So yeah, so you should just know where your strengths are. So like for me, I could say that I thought I was good at English or logical reasoning. So whenever aptitude test used to come, I used to attempt those sections first,
Yeah.
because these tests are always timed. You will have like maybe 45 minutes, 1 hour. So you should always play to your strengths and be smart about it. So you need not study so much that you get top marks or you get 100 out of 100. That's not required. So yeah, you have to be smart about how you put your efforts, where you put your efforts. The second round is group discussion. Again, it would be helpful to talk to seniors and understand what kind of topics they were asked, so
Yeah.
that at least you will have a reference point on how you can start preparing. But the most helpful thing would be to practice with your friends, to have a group of friends in a circle, sit in a circle, give a topic, and ideally they give you like 1.5 minutes to jot down your points, and then you have to say about it. So again, one thing to remember is that you do not need to be the most dominant person in the room. You just have to say like two or three clear points to get your statement out there, right? So you need not be very aggressive. It's not a debate. You don't need not be aggressive. You need not cut off other people, and you can still clear the group discussion round easily. And the third is the interview rounds. So the interview rounds can vary. Like there is there is no way one can predict how the interview goes. But there are some simple ways that you can prepare for it. Like, one thing is, first and the most important thing is your CV. So you have to make sure that your CV is very good and without any errors, and you should know whatever's written in your CV.
Yes.
So you cannot write that I am good at Excel and not know anything about Excel, because what the interviewers would focus on is whatever's written in your CV, because they do not know you, right? So they only have your resume to judge you. So basically, they ask questions from your resume. So the first thing is, whatever you write in your CV, just be confident about it and know as much as possible about it. And second thing is, when you go via college placements, your project plays a very important role. So whatever project you have chosen for your final semester, you should know all the details about it, and you should be able to effectively explain it to the interview panel that this is what I'm doing and this is the outcome of the research and these are the tools and techniques that I'm using. And the third thing would be, so there are some common HR questions that you can always be prepared for, like what are your strengths, what are your weaknesses, where do you see yourself in 10 years. And there are these list of questions are easily available in Google. So before sitting for any interview, it's good that if you go through these questions and prepare your answers for it in advance, so that you do not think aloud about it in the interview. And it is always ideal to, tailor your answers to that particular role or the organization that you're applying for. So, it's always useful to go to their website to understand more about the role, and then you tailor your answers accordingly. That always helps.
Agree with you. Agree with you. Work smarter, not harder, and also give generic answers. That's not usually good.
Yeah.
Yeah. And yes, thank you, Chechi. Thank you. That was a very elaborate and detailed answer. Like it is going to really help anyone who's watching this video. I remember that you mentioned that you currently work in market research. So can you give a bit of an idea about what this role is and
Yeah.
how you work on a day-to-day basis? So if anyone wants to join market research, what to expect?
So I am currently working as like a research manager for the strategic and insights team at the United States Pharmacopoeia. And basically, my role involves conducting primary research. Now, primary research is generally to find answers to something that is not readily available, right? So we know that there are primary sources that are secondary sources, right? So secondary sources contains internets, books, and first-hand articles and all those things. So suppose my company or my organization wants to evaluate like the performance of a specific product or a program that they have initiated, they would not have answers for it anywhere. So we have to do surveys and we have to collect data to get some meaningful insights that will help the organization. So that is what basically primary research is. So that is what I do on a daily basis. I try to design surveys, I get the data, and I try to derive some meaningful insights that will help my organization and help them make some strategic decisions. So yeah, that is why I come under strategy and insights. Whatever like the day-to-day thing that I do, mostly, there is a lot of Excel, there's a lot of PowerPoint, and there are some other tools like questionnaire designing tools that I have to use. There's a lot of management amongst different teams to get your work done on time.
That's amazing. That's amazing. You have given a clear picture of what to expect in market research. Thanks for that, Tichi. And also, I think I wanted to ask you a very cheeky question as well. Like, suppose if you hadn't gotten to NIPER and you did not clear Gpat, what would have been your plan B? This kind of helps someone who is right now like stuck and did not clear Gpat. They can take your opinion.
It's obviously very tricky, right? So even if you prepare for GPAT, sometimes, the luck might not be in your favor and you might not clear it. So it's always a very tricky situation and you might not know how the results come, right? And again, NIPER had its own entrance. So that was also another barrier that I had to clear. But I did keep some of my options open. It was like, okay, if I cleared GPAT, I had to write NIPER or but apart from that, there are also several entrance exams like BITS is also there, which does not technically depend on GPAT. And also, of course, Amrita was always a good option for me. But I did want to go outside and explore a bit. That is why I kept it as like a backup option. And there were a few colleges which again I was interested in, which was like Bpharm, which is in Delhi Institute of Pharmaceutical Education, and there was Bombay College of Pharmacy in Mumbai. So I had also checked the admission criteria for these, and I had actually started to apply for these before I'd got my GPAT results. So having GPAT results would also help you with these institutes as well. But they do not necessarily need a GPAT. They basically need an aggregate of your whole 4 years marks. So yeah, it's always good to have a lot of options with you, and it's always safer that way. But yeah, I was always leaning towards NIPER from the beginning. So yeah.
Thanks for that comprehensive list of all the pharmacy schools and colleges you were looking at. That's great, Chechi. So, so if you could give an advice to any fresh graduates who are looking to, yeah, like kind of confuse what to do next after Bpharm and even after M Pharmacy or MS, what is your advice going to be?
So I have been exactly in that phase where, I had no idea what to do. Pursuing masters is always advantageous in terms of either job or for research. And then maybe, during your masters, you might get an idea of where you want to go. If you're still unsure, you can still sit for placements. And, initially, like when you sit for placements, right, you're not maybe interviewing for a particular role, you're interviewing for a team, and they just take you in, and then you start learning about how the industry works. So you can always go that ways as well, that okay, you have no idea what to do now, so let's just try for a job and then start there and understand what your interests are. So there is always another one misconception that I've noticed is that people feel that okay, like how you said, people start with pharmacovigilance. So there is one misconception that okay, since I've started with pharmacovigilance or I have 2 to 3 years experience in that field, I cannot move anywhere else. That is extremely wrong, is what I found out. So even after like 4 years, 5 years, people still switch their careers. So that is not an issue actually. So whatever may be your starting point, that is not an issue. If because people find their calling at different times, right? You never know when it strikes. So that's okay. If you find interest in one particular area, you can still switch to that area. It's all you need to do is, study a bit in that area, modify your CV accordingly, and then sit for interviews. And yeah, you might not clear a couple of interviews, that's okay. But each interview will give you an experience of, what the role demands and what are the techniques that you need to learn. And you can keep preparing accordingly and, use each interview as an experience and, try to crack that one interview that will give you the role that.
Yeah, absolutely agree with that. It's the transferable skills that you bring from one role
Yeah.
to another.
Yeah.
Like if you kind of like are a subject matter expert in one of the product area, if you were doing pharmacovigilance, you can obviously move to medical affairs or regulatory affairs. That's
Yeah.
a pharma, so you can always do that. Thank you so
Yeah.
much, Chechi, for that. And also, if anyone wants to connect with you and ask their questions more personally, how can they
Yeah.
do
So I'm always there on LinkedIn as well, and I'll give you my email ID so that maybe you can add it and people can reach out to me anytime. I'd be happy to help actually, because I exactly know how it feels to be very confused and very lost. And basically even I've just gone with the flow and just done what it takes. But yeah, there is a countless opportunities available for everyone, irrespective, like whatever their interest is. If it's even in computer, if it's jurisprudence, whatever. Like I think there is every field, anything with pharma and other field can always give you countless opportunities. Like pharma is a very niche and very sought out field right now.
Yeah.
Because yeah, healthcare is booming right now and it is very much in demand. So you just need to find your interest and work hard towards it. So yeah, I think
Yeah, I
that's
agree with you. It's just that everybody is like now focusing on the abroad scope because that's what
correct.
we were told initially. Like for PharmD, it was
Yeah.
okay, you have scope only abroad. And then that's how I was in London. And
Mm.
like India, because of the IT boom, there is a lot of opportunities that's coming up. And how do you feel about that?
Yeah, actually, it's quite good. So, even same as like how you said, even after Bpharm or Mpharm, I was actually uncertain,
Yeah.
that where would I fit in this industry? Like, what would I be able to contribute? But that's actually not the case, because if you see any big company right now, the big four company, the big consulting companies, literally everything will have a healthcare department, very dedicated healthcare department, because they would have invested in some or the other healthcare technologies. And all these companies would actually prefer someone who has a background in science or scientific knowledge. So that can always play to your advantage. So I think it is perfect time to use that to our advantage and take charge of it and make use of it. because yeah, I think right now it's a good time in the industry overall.
Yeah, thanks, Stacey, for that. And this is the final question that I ask everyone who comes to my channel. I said, do you love what you're doing? And is pharma a good career option for everyone?
Yeah, actually, I loved studying Bpharm. I'm not even kidding. I used to love a lot of subjects and I was very interested in it. But I do know, to be honest, I agree that the syllabus is a bit outdated in India. I'm not going to say that, it is on par with what the industry needs. It is a bit outdated, and this is something that we need to collectively work on, to update the pharma education system. Um, yeah, and on terms of the work that I do, so it does not directly help me with my day-to-day job, but having that sound knowledge will it always helps me, whenever I give recommendation to my clients or my stakeholders, and whenever there is complex terminology involved, I'm able to, explain it in simpler terms to people, and that always helps. So, if you love pharma and you want to stay in this industry, having a good basic knowledge of all the pharma subjects comes in very handy, and it can help you with your career as well.
I feel like everyone has gathered a lot of information from this interview, and they are able to like choose and decide what they want to do further. Thanks a lot for all this information.
Thank you so much, Raki. Actually, I think this is a wonderful initiative, to be honest. And I did not know about it. Like, once you sent me the invite, I actually went and checked your channel. And I realized that, like a lot of pharma graduates are kind of clueless. And I think this helps with that, right? So I think it is a wonderful initiative by you. And, great work. And so I just wanted this opportunity, like, to share my experience so that, if there are some people out there thinking that, okay, there are no opportunities in India, they shouldn't feel that, right?
Absolutely. I feel like you have given us a wealth of knowledge, and these insights are like really valuable. And like everyone has a different career path, and anyone can get inspired from that or can
Yeah.
choose that way of
Yeah.
career and life. So that's really amazing. Thank you so much, Chichi, for doing this.